same as in the sheep parts, right? You want to orient yourself. Obviously, it's a little bit easier on this one. And so you have your anterior aspect, and of course the posterior aspect is what it's resting on now. Apex base. Right? Here is the anterior interventricular sulcus, where you see the anterior interventricular artery and the great cardiac vein. Here you see the circumflex artery coming around towards the left side. On this side you see the coronary sinus, where you visualize or where you can see the right coronary artery. And that's going to come all the way around until it gives rise to the posterior interventricular artery in that posterior coronary sinus. Here's the coronary sinus, right? Which is going to drain all of this venous supply back into the right atrium. A few other features here. You have the right and left auricles, pulmonary trunk, the aorta, the superior and inferior vena cavas. On the posterior aspect, you see the pulmonary veins coming from right and left lungs. And then here you see the pulmonary arteries. On the aorta, notice there's 3 openings here as opposed to the 2 in the cat. So from anterior view, you would have the brachiocephalic, the left common carotid, and the left subclavian. Then the aortic arch, which will come around and give rise to the thoracic aorta. If you open it up, you see your right and left atria. Remember, these are the receiving chambers. If you consider the right atria, you're going to end up receiving oxygen poor blood from the systemic circuit and from the coronary circulation. If you consider the left atrium, this is going to receive oxygen-rich blood from the pulmonary circuit. Here are your 2 AV valves. On the right side, you have the tricuspid. On the left, you have your bicuspid. So again, these prevent backflow of blood from the ventricles back towards the atria. As far as some of the features that you should remember here, the chordae tendineae, the white string-like cords that are going to anchor the valves onto the walls of the ventricles, which that's where you're going to see the papillary muscles, and actually anchoring those chordae tendineae. Here is the interventricular septum. If you look at the muscular ridges that you see within the ventricles, these are your trabeculae carni. The other thing you want to notice is the difference in lateral walls here. On the left side, the wall is a lot thicker than that is on the right side. And that's because this has a greater workload as far as pumping to the entire body compared to this just pumping to the lungs. As these ventricles contract, this is where you want to consider the semilunar valves. Right, so from the right ventricle, as the blood is being pushed out, it'll go through the pulmonary semilunar valves into the pulmonary trunk. And then from the left ventricle, as that blood is going to go out, it's going to push through the aortic semilunar valve, which you can see there, right, as it's moving out into the aorta. And I think that's it.